Anthony Fauci, Deborah Birx, Brett Giroir, they never thought of treating the virus. The only thing they could think of was masking, social distancing, and waiting for a vaccine. This biopharmaceutical complex had a single objective, and that was worldwide mass vaccination. Anything that got in its way was crushed.
We just need to scare the living daylights out of them. That was the plan, to get everybody to comply.
Fear drove irrational behavior. Autopsies were coming in. All these people had taken the vaccine, it was well documented, and they died. Our top line results were that 73.9% of everybody who died after the vaccine, in fact, the vaccine was the cause of death. I think the biopharmaceutical complex said, wait a minute, we can't let this message get out. We're talking about over 500,000 Americans dying of the vaccine. Do you know 1,100 people died, Americans died of the vaccine on the same day they took the shot? Some people just die in the vaccine center or a few minutes or a few hours afterwards. It's that acute. So I can tell you this biopharmaceutical complex, they have an objective for mass vaccination. Just get ready for it. The WHO is on a runaway mission to control the world. It's almost like a bad movie.
What's going to stop them from doing it?
The only thing that's going to stop them is the whole world waking up to the truth. And if the whole world wakes up and says, no more, this whole plan dies.
The world is changing. Inspiration is everywhere. It has never been so easy to connect, share, and bring people together. We're learning from others and finding the best in ourselves. Challenging our beliefs. Sharing our vulnerability. Overcoming our fears. Transforming ourselves so we can transform the world. How far can we go?
This is London Real. I am Brian Rose. My guest today is... This is London Real. I am Brian Rose. My guest today is Dr. Peter McCullough, the internist, cardiologist, and epidemiologist. You are one of the most published cardiologists in America, with over 1,000 publications and 660 citations in the National Library of Medicine. You were an early leader in the medical response to the COVID-19 pandemic, yet soon became censored and the target of mainstream media propaganda. You believe that now Big Pharma has established misplaced power over every aspect of our lives and taken away our liberties. You have testified before both the U.S. Senate Committee on Homeland Security and Governmental Affairs and the Texas Senate Committee on Health and Human Services. Ultimately, your mission is to bring truth to the world and fight for medical freedom through actual scientific data and analysis. Peter, welcome to London Real.
Thanks for having me. It's a pleasure to be on.
It's great to have you here, and I just wanted to call attention. I just watched the testimonial you gave on March 10th, 2021 to the Texas Assembly, and I highly recommend everybody go watch that. I'll post the link as well. That 15 minutes is just something I feel like everyone in the world should see. Kind of like they should see Dr. Martin's testimonial in the EU he did a couple months ago that just kind of summarizes, just a point in time where it seemed like there was just madness going on. And I know we're going to get into a lot of things today, but when you look back at that, or when someone sees that for the first time, what is your reaction, and what do people do when they watch that for the first time and think, wow, we weren't doing all of these things that we normally do, and yet nobody really questioned it at the time?
I sat through report after report of different governmental agencies in the state of Texas to the HHS committee, and they were reporting on masks and hand sanitizers and lockdowns and vaccine distribution. Not a single report on treating sick patients. And that's what my focus was. I said, where is our attention to people sick and dying right now? That was a shot across the bow. The committee really, I think, awoken And, that got me on Tucker Carlson. A month or two later, that was a breakout interview. That sent Tucker down a 2-year journey that ended his tenure at Fox, because Tucker kept asking the questions, why aren't we focusing on early treatment? And how can we prioritize vaccines that are racking up a track record that no one can be proud of?
And for people that haven't seen that, how would you summarize what you were telling that committee?
I was telling the committee that in the setting of a pandemic, there's always a small number of people at any given time who are sick. And if we focused all our resources on them, that's the best chance of helping them avoid hospitalization and death. Those are the only two important endpoints. To focus on everybody well with masks or lockdowns or vaccines is misplacing a huge effort for a large number of people who are not at risk.
And I remember in that testimony, you said that you were in touch with a lot of the doctors in Italy, and you all came up with, a protocol that people could use right away on treating the disease. And you came up with these, basics. You called them kind of off-label, and then that was kind of silenced and quelled right after that.
It's true. The 2018 FDA guidance said doctors should use drugs off their original advertising labels when they are fulfilling an unmet medical need. That's exactly what we were doing with hydroxychloroquine, ivermectin, colchicine, doxycycline, azithromycin, budesonide, prednisone, enoxaparin. That's how we treat COVID. And that's exactly what we were doing. But there were certain drugs that were lightning rods. And the first one was hydroxychloroquine, where there was a crushing response that no one should receive hydroxychloroquine. It was extraordinary. Do you know that billionaire Clive Palmer in Australia procured an entire supply of hydroxychloroquine for the whole population of Australia? The governmental authorities seized it and destroyed it.
And why were they targeting that? Because if it was proven to be useful, then there would be no vaccine mandate.
It's hard to ascribe motive, but why not just let people use hydroxychloroquine? If government authorities or other doctors didn't think it would work, why would anybody care? Why would anybody care about ivermectin? It's got a safety profile better than acetaminophen. If it didn't work, but we wanted to give it a try and people are willing to pay for it, why would anyone care? What we found is the government, and what we describe in my book, Courage to Face COVID-19, a biopharmaceutical complex, a very, very powerful syndicate is formed, that this biopharmaceutical complex had a single objective, and that was worldwide mass vaccination. Anything that got in its way was crushed.
And how did that happen? Just as an aside, doctor, I had been broadcasting for 9 years. I had 2 million subscribers on YouTube, 9,000 videos. I had never had a single video removed. And on April 6th, I had a live conversation in this studio where the guests started questioning some of the protocols and things that we were doing. And it was immediately banned, deleted, and censored. And I started a big war with YouTube. And I thought the weirdos got censored until it happens to you. So I was kind of in the middle of it, and I didn't know what was going on, but clearly something was going on to silence this.
You hit a nerve. You were over the target. There's no doubt about it. Things that didn't work or things that didn't threaten the vaccine agenda, nobody cared about. But everything else was vilified. When there was a dozen randomized trials, 3 large ones showing that virucidal nasal washes and sprays worked using povidone iodine, for example. We incorporated that into the McCullough protocol, which became the most widely used protocol or platform to treat COVID patients. First issue of this was American Journal of Medicine, August of 2020. The second one was Reviews in Cardiovascular Medicine, December of 2020. When we had the iodine-based washes in the protocol, which revolutionized treatment, immediately, one of the major doctor email services, I think it was either Medscape or one of the other ones, sent out an email. It said anti-vax doctors pushing iodine sprays. Patients will swallow it and die. You can't make this stuff up. Hydroxychloroquine being destroyed. You have Jackie Stone in Zimbabwe being put behind bars because she saved a man's life with ivermectin. You have doctors being decertified all over the place, Canada, Australia, New Zealand, France, because they attempted to treat their patients and help them avoid hospitalization and death. You can't help but wonder, who is behind all this? Why is worldwide vaccination such a big priority? And that anything that helps people get through COVID-19 illness is crushed.
When did you realize that something was going on? Like, when did you say, okay, this is obviously, we are moving toward mass vaccination? Like, was it in April or May or June where you could really see the information being suppressed, all the other agencies going along with this narrative? And then also, how did you react?
I think my first moment was like yours. It was with YouTube. Now, I previously wasn't in social media. I didn't have a YouTube channel, but I had a very important paper. I knew it was probably the most important paper of my career. And as you mentioned, I now have over 680 listings in the National Library of Medicine, PubMed. Average professor in your country and mine, average professor only has 25. I have 680. Some of the big people in the U.S. vaccine world have 100 or 200. So, I am an academic authority that really worldwide is recognized what I've done. So when I had this paper, I'll never forget, my daughter was home from school and she says, well, why don't you make a YouTube video out of your paper? I said, well, I've never done that before. She showed me how to do it. I just had 4 slides in a PowerPoint showing the cover page and then the key figures. And then I was just in the lower panel. I wore a suit and tie and I described the papers in a very scholarly way. I described the concepts and it was published on YouTube and then was up and it went viral. It went absolutely viral and then it was stricken down from YouTube, violated terms of the community. I said, wait a minute, this is a scientific paper that's peer-reviewed and published. And then sure enough, I got a call from Senator Ron Johnson in the US Senate and I knew something was up. So, things started to really accentuate. That's when it hit home. I had a call earlier in the year in 2020 from Peter Navarro, who's in charge of commercial operations of the country from the White House, asking to assist on the emergency use authorization expansion for hydroxychloroquine, which it didn't need to begin with because it's an over-the-counter drug. And so there was a sense that things were going wrong with pandemic response easily within the first 6 to 9 months.
Okay. Now, also in that testimonial and early on, you said some other bold statements. One is you can't get COVID twice. The asymptomatic people aren't going to spread it. I mean, these are things that people were not talking about when you mentioned these things.
Well, we had data from the wild type alpha, beta, gamma into delta that there weren't large numbers of recurrent cases. I mean, it was the natural immunity was so reliable. Some countries were just, they ran out of masks. They just had the recovered workers take care of the sick ones. I mean, that happened in Sri Lanka for sure. I helped them in that effort. And then, what really broke natural immunity was the Omicron variant. So, when I went on Joe Rogan on December 8th, 2021, I set all records for his program. He's the most popular podcaster in the United States. And I eclipsed Elon Musk, anybody he's ever had on. It just went absolutely viral. And Rogan was astounded. The Spotify producers got involved and different entertainers, Neil Young and Prince Harry and President Biden and Jen Psaki in the White House. Everyone got involved in this swirl around McCullough's Joe Rogan interview. But in that interview, I said, listen, we're relying on this. I've personally seen patients. I've gone into their homes. I don't wear a mask because I've already had COVID. You can't get it twice. And sure enough, 2 days later, the CDC comes out with clear proof with Omicron, you can get it twice. It broke through natural immunity, blew through vaccine immunity. And that night, I was on national TV. And I told America, listen, the virus mutated, things changed. So, I've been honest with the country and the world as the virus has mutated and changed. There's 15 million hits on me on the internet, on Google. You can't find a statement where I've contradicted myself or I've been grossly incorrect about the pandemic. But yet every public official has got a long string of just regrettable statements. We see these highlight reels all the time. Now, asymptomatic spread, that was a very important concept. 2 papers, one by Madewell and the other one by Cow, definitively showed that perfectly well people don't transmit the virus to one another. It's always a matter of coming down with it and getting sick and spreading it to a susceptible person. So that became so clear that in June of 2021, just 3 months after my Texas Senate testimony, the WHO came out and said, stop asymptomatic testing. It doesn't spread that way. And it wasn't until a year later, summer of 2022, where the CDC said, stop asymptomatic testing. But when I made the call in the Texas Senate, I was right.
You also said you can't spread it with your hands because it's a respiratory virus. Can you talk a little bit about that? Because, I got 2 young boys and they were in school and, they were just washing the hands and washing the hands, and I would see them do it. And it disturbed me how they were almost like, I don't know, damaging these young kids by like wash hands, wash hands, wash hands. Tell me about that.
It was almost every 6 feet in an airport, you'd see hand sanitizers. Now, listen, I'm not against hand sanitizers. I use them in the hospital, in the clinic. I use them every day in my professional life. I'm not against it, but it just wasn't going to make a dent in the spread of the virus. The virus was aerosolized, and it was in the air, and it took very little exposure. So if someone came into the room with me or you and they had it, within 2 or 3 hours, we could get it. The ridiculous thing was this idea that it's transmitted by the hands. That was ridiculous. And here's another one. It was so contagious that we had to lock down and wear masks and socially distance. But in order to find the virus and test it, we had to use very long swabs and go way up the nose. Wait a minute, if it's so contagious, why is the virus so hard to find on testing? I mean, none of that made sense.
How do you explain how so many people could miss such obvious things, or be convinced to do such ridiculous and ludicrous behaviors that even if they weren't doctors, they should be able to really see that something is just not right here?
I think fear is a powerful, powerful emotion. I was on Laura Ingraham on national TV, the Ingraham Angle, Fox News, and she showed a highlight reel. I think the most obvious examples of what you're bringing up is masking. Of someone in an Olympic swimming pool wearing a mask and swimming lanes, somebody running in a track meet wearing a mask and, running as fast as they can for 1,000 meters, people driving alone in the car wearing masks. There were case vignettes of people getting sick with COVID in the hospital. So they already have the illness and then getting a vaccine in the hospital. They're already sick with COVID. We never do these things. And I think it's basically fear. Fear drove irrational behavior.
Yeah, our health secretary, Matt Hancock, I think they found some leaked messages for him recently, and he said something to the tune of, we just need to scare the living daylights out of them. That was the plan, to get everybody to comply. So, they just knew to dial it up. That's what you would do. And yeah, look, doctor, I knew people that I would previously considered extremely rational, highly intelligent, highly successful. And yet when their groceries would be delivered, they would take an hour and try to wipe off all the groceries with some compound. And I was looking at them like what's wrong with you? So you're right. Fear, when it's dialed up, it just brings out massive irrationality in humans, and it can be used, I guess, to control.
Well, don't forget, it was also accentuated and reinforced by the media. Media commentator Sanjay Gupta on CNN had a whole section of one of his reports on how to sterilize pizza boxes and groceries before you bring them in the house, and he was doing it himself. This didn't transmit like Ebola. This was a respiratory illness. It was clearly shown in the literature. It was transmitting, by aerosol spread. And, clearly anything that spreads by aerosol can spread by a droplet. So a big gooey sneeze certainly could transmit droplets. So, masking made sense, for instance, in the hospital setting where people are highly symptomatic and there's a lot of coughing. And even to this day, the CDC now says The only time we need to wear a mask is when we go into respiratory isolation, just like we would with tuberculosis or another respiratory illness. So we're now back to sanity. But the fact that the CDC, the FDA, the NIH, the White House Task Force in the United States, they spent largely the first year solely on perseveration on masks, social distancing, and lockdown. And this is chronicled in Scott Atlas's book, A Cloud Over the White House. And in that book, I read the whole book, that Trump met with Atlas and a whole series of experts, Anthony Fauci, Deborah Birx, Brett Giroir. And they never, according to Atlas, they never thought of treating the virus. The only thing they could think of was masking, social distancing, and waiting for a vaccine. And this is after Trump himself was hospitalized, and he received basically a version of the McCullough protocol. He had previously been pre-treated with hydroxy. He had received famotidine, other nutraceuticals and supplements. He received monoclonal antibodies, which was part of my protocol. And, he got through the illness. So, you think it would come into his mind that, gosh, I got through it at my age. Why can't everybody get what I get so America can get through the illness? But yet, according to Atlas, it never came up.
I mean, speaking of your protocol, I think Joe Rogan followed that protocol, kind of told the world that it was over in a few days. And then, of course, speaking to the mainstream media, I think including Sanjay's channel, they came back after him with ivermectin, the horse tranquilizer, and then, blown up everywhere. And then I think later Sanjay came on Joe's show and he was just like, well, what is this all about? Yeah, what did you make of that? Was that just, again, another example of them having to quell anything that looked effective besides the vaccine?
The FDA put out a communication saying that ivermectin is horse paste, but yet it's a human medicine. 2015, it won the Nobel Prize. The drug won the Nobel Prize for being a very effective treatment for river blindness. I had used it for years in treatment of various parasitic infections, lice, what have you. So ivermectin is just part of what we do. It's routinely used in veterinary medicine. So, and very safe, safer than Tylenol. So once the news broke that ivermectin was safe and effective in COVID-19, we now have, probably about a 55% treatment effect, benefit effect, done in dozens and dozens of clinical trials. No single trial was large enough, nor sufficiently long enough using the right drugs, doses to declare individual superiority in a trial. But, in aggregate, ivermectin clearly works. I've used it in my practice. I can tell you it works. The fact that it was vilified to such a degree. Do you know the American Medical Association in the fall of 2021 launched a campaign to abolish the use of ivermectin? Abolish the use. Why would the American Medical Association take such a stand? It turns out that, earlier in 2021, do you know all the medical associations, Hollywood, all the sports teams, all the media, over 4,000 media outlets, they all took money from President Biden and HHS. It's called the COVID Community Core Program, $13 billion to push COVID-19 vaccines. And once the government had money out to all these organizations, they had leverage, and they had leverage on the messaging. And that was to suppress any hope of treatment in order to railroad vaccines on the population.
Is that emergency use piece that comes through if you can't prove that there's a drug on the market that can have an effect on it, then they can go ahead and put in that emergency use and then, of course, push through the vaccine? Is that probably what the thinking was here?
Emergency use authorization, which is a military mechanism, was absolutely employed here. And it said if there's no effective alternatives. And, by the time the vaccines come out, we already have McCullough protocol published. We already had a home treatment guide that was published by the Association of American Physicians and Surgeons. We basically beat the vaccines to the punch. And so our work, it appears that this biopharmaceutical complex, they had to crush our efforts in order to front these vaccines to the public. Vaccines that were rushed through development, had no assurances on safety or efficacy beyond 2 months. And boy, what a disaster it was.
Wow. And I've had Ed Dowd on, and I think it was him that was going through the figures of a lot of the money that was actually pumped through government organizations into advertisements, some of the stuff that you just mentioned as well, to either push the vaccine or quell other treatments. And when you see it there in black and white, it's hard to believe that happened.
It's true. I mean, what I told Tucker Carlson was, it's the same people. So if the AMA is trying to abolish the use of ivermectin, they had previously had strong messages against hydroxychloroquine in early treatment. They were strongly in favor of the vaccines. I mean, none of these entities had any equipoise on this. I mean, one of the most severe examples is the American Board of Internal Medicine, which is now currently threatening my certifications. Do you know that the Pfizer vaccine rolled out in America December 10th, 2020 by emergency use authorization? Do you know by December 17th, 7 days later, the American Board of Internal Medicine puts out a message to all the members, and this is all internal medicine and medical specialists in the United States, hundreds of thousands of doctors, and the message said, get a vaccine and take a selfie of you taking the vaccine and your vaccine card and show it to your patients to promote the vaccines. Now, how did they know 7 days after release that they were going to work? How did they know they were going to be safe or unsafe long term? I mean, none of these organizations had any equipoise on this. They should have been neutral. Do you know these organizations, let's say the Royal College of Physicians of Canada. I've recently been in court with the Ontario College of Physicians and Surgeons, the National Health Service. You can go on and on and on. Do you know none of these organizations put out warnings to doctors and patients to be cautious regarding problems? They never did.
Warnings about any of these issues, vaccine.
Right. So when the vaccines, when we started to see deaths after the vaccine, there was no warning like, people could die of an allergic reaction. These were well chronicled. They were in all the safety databases. They could cause heart damage, cardiac arrest, blood clots, Guillain-Barré syndrome. The FDA, October 22nd, 2020, had a slide in one of their public meetings that's still available out there, and it listed everything they expected with these vaccines: myocarditis, blood clots, Guillain-Barré syndrome, stroke, paralysis, multisystem inflammatory disorder, bleeding disorders. They listed them all. These were all expected adverse events of interest because we knew the vaccines installed the genetic code for the lethal Wuhan spike protein, that unnatural protein that was devised in the research lab in Wuhan, China. This was known. And yet none of these organizations were properly warning doctors, patients, pharmacists, and others what was going to happen.
Doctor, what is it like for you to watch all this happen, kind of like a train wreck in slow motion? Because you're seeing it, you're seeing the inevitability. You probably have to wonder, how can this actually be happening? And then you have to watch it play out over the last 3 years. What's that been like? What has surprised you? What has not surprised you about the entire rollout of that vaccine and all of the injuries and everything that's happened since?
What surprised me is just the deafness, the willful blindness. Let me give you an example. By invitation in the first year of the pandemic, I was invited to write a regular opinion editorial in The Hill. That's a widely read journal for lawmakers in Washington, House, Senate, White House. And in August of 2020, I published an op-ed. You can still on their website. It was called The Great Gamble of the COVID-19 Vaccine Development Program. Do you know I was the only public figure to question the vaccines in writing ahead of time? The only one. You're looking at them. No one else questioned it. People were really late to the party. Joe Rogan, Tucker Carlson, every person in the media, they were really late to the party. All the medical organizations were very late. I questioned it. And in Scott Atlas's book, and Scott was in the White House at that time, we were texting each other, emailing each other. He was publishing op-eds in The Hill about masking and social distancing. He never acknowledges my concern regarding the vaccines. Never comes up. Never comes up. And it's just like, why are people blind to the viewpoints of other people, especially me? Someone like me in America, if I'm questioning the vaccines, the entire country should have said, wait a minute. We need to talk to Dr. McCullough. He's published more than anybody. If he sees something here doesn't look right, let's get him into the White House.
Did you ever want to just toss your hands up and say, okay, I give up? Because, I mean, saying the same thing over and over again and nobody listening to you since, mid to late 20, all the way through 21, how do you stay focused to keep putting out that message?
Well, I tell you, if leaders of, let's say, the White House, the Congress, and the Senate, if they weren't completely listening, boy, people were. My papers had record downloads. I told you, I went on Joe Rogan, set all the records. I go on Tucker Carlson's, sets off all kinds of media hits. I've given thousands and thousands of interviews at this point in time. And so my worldwide impact has been extraordinary. I go into airports, people recognize me. I'm anywhere in the world, people come up to me. And so it's obvious that people can see the truth coming out. And people have looked to me as a reliable source of the truth. Every time I've attempted to be censored, my message gets louder. And this has happened recently with a major paper I submitted to Lancet.
And what happened with that paper?
This is a stunning development. Autopsies were coming in people who have died after the vaccine. And they were coming in one by one. And we'd look at them and, as the knowledge base grew, but there were no clear patterns. So I was contacted by the University of Michigan School of Public Health, of which I'm a graduate student there, Nick Hulsher. We got a project fully approved. And what we did is we searched through 600 peer-reviewed papers to glean all these autopsies and get them into evidence tables. Then we independently adjudicated them. Now, all these people had taken the vaccine, it was well documented, and they died. And we had 3 independent reviewers, and we adjudicated them. And with modern knowledge of our mechanisms that we understand, in fact, do cause death, like blood clots and heart damage. And our top line results were that 73.9% of everybody who died after the vaccine, in fact, the vaccine was the cause of death. I mean, this is a huge finding. So, and I had published in Lancet early on in the pandemic. So Lancet knows me. I'm one of the most published people in the world. So we submitted to Lancet. I'm senior author. Nick Hulsher is the first author. Lancet views it reasonably favorably in the editorial office, and they triage it to a lower Lancet journal. I respectfully declined because it needs to go in a top shelf journal. But Lancet said, well, you can put it on the preprint server. Now, preprint server is a way of displaying data ahead of peer review just so we can get it out, since publications can lag 2 to 4 years. So we accepted that invitation, and then we went through 2 reviews on checks and methodology and the conclusions. Everything was okay. So it gets up on the Lancet preprint server. It's getting surges of downloads overnight. And then the next day, Lancet or the publisher Elsevier shuts it down. They said the methodologies, it doesn't support the conclusions. I mean, wait a minute. Where did that come from? There was no courtesy call from Lancet, no email discussion, nothing. So we put it up on the European Commission server, the EC Commission Zenodo server. And an average paper like this, and we've benchmarked it, we get about 50 downloads and reads. It's just kind of how the world is. There's about 250,000 papers on COVID vaccines. Our paper, as we sit here today, is right at about 200,000 downloads and reads, probably setting all records for any COVID paper. So the point is, Lancet or Elsevier tried to censor it. I think probably because they were influenced by outside forces, this biopharmaceutical complex that I've outlined in my book. I think the biopharmaceutical complex said, wait a minute, we can't let this message get out. This is too strong against the vaccines. And when they attempted to censor it, it just triggered more interviews, more review, more discussion. It gets up on the European Commission server, and it's absolutely flying off the shelf. And censorship always backfires.
It does. It always does. What is the current state of the union? What do you think that the general public thinks about the vaccines? And what is the state of all these vaccine injured? We obviously see all these reports. We hear all these things that I don't remember hearing as a kid, where sports stars and young actors are dropping dead, but also it's anecdotal. Like, where are we right now? Is most of the public starting to wonder? I know uptakes of boosters have gone way down here in the UK and maybe in the US, but where are we?
There's a report out today in the British Medical Journal saying people are walking away from vaccines altogether. I mean, the COVID shots were a disaster, but people are just starting to walk away from the entire vaccine schedule. And it's like an emergency communication out in BMJ today. If someone's following the UK or US government guidance, they should be on their seventh shot. Seven genetic shots, with no assurances of what would happen beyond 2 shots. Do you know anybody who's taken 7 shots?
No, but I don't know that many people that would do that.
Well, I mean, here's my point. Has your prime minister or either one of our 2 presidents, don't forget, President Trump and Biden were very favorable on the vaccines. Our CDC directors, our NIH directors, FDA. Has anyone come out and said they've taken seven of these shots? How about Justin Trudeau, Angela Merkel? Can we think of anybody who's publicly said they took 7 shots? I'm still waiting to hear. And you can't think of anybody. I can't think of anybody. I think what's going on is people quietly know these shots didn't work. They're unsafe and they're ashamed. They're remorseful. A lot of people are heading for cover. Athletes take these shots. They have cardiac arrest. We know myocarditis causes cardiac arrest. That's proven. So, these kids getting myocarditis with the shots and they continue to exercise, they're going to have cardiac arrest. University of Southern California basketball team. They had a kid last year have a cardiac arrest. He got a defibrillator in, and now son of famed basketball player LeBron James, Bronny James, has a near-miss cardiac arrest. The case that bothers me the most is the case of Oscar Cabrera Adames. I don't know if you heard about this case, but it's a basketball player, European leagues. He has a cardiac arrest in 2021. I mean, face down on the court, just an absolute face plant. He's out. He gets resuscitated, and then he tweets out, he said, "I got myocarditis from the vaccine, and that's what caused my cardiac arrest." So it's a clear case. This wasn't concealed. Well, the poor guy is trying to return to pro basketball, and he's on a treadmill test in 2023 to return to basketball, and he dies on the treadmill. They can't resuscitate him. Now, I'm a cardiologist. I've done treadmills my entire career. I've never had a patient die in the treadmill because we're right there. We can defibrillate and do all kinds of interventions. That case scared the crud out of me, because if someone can have myocarditis in 2021 and die of cardiac arrest in 2023, we are in trouble. These cardiac arrests may have just begun to come into public light.
And so let's go deeper on that. What is the state of vaccine injuries? And again, like you said, it's early days. I think some 5 billion people in the world had the vaccine. And so where are we at? I mean, I've had Ed Dowd on. He's talked about some of the actuarial tables, and you're starting to see these like 3 sigma variations where kind of healthy people in their kind of mid-level execs are missing all these days of work and all these numbers that are, in his mind, blatant proof that there's vaccine injuries, even if they're not the catastrophic ones. So where are we in that?
To summarize, we've seen record injuries, disabilities, and deaths. There's been no biopharmaceutical product that's been as damaging or lethal as the COVID-19 vaccines. United States, 75% of people took the vaccine according to the COVID states program. CDC says 92%, but it's not legit because they double counted some people. So 75% of people took it. Of those who took it, 94% took a genetic vaccine, messenger RNA vaccine. Few took Janssen and adenoviral, another genetic vaccine, and a tiny fraction took Novavax. That was the only antigen-based vaccine. What we know is that According to a Zogby survey last summer, 15% of people who took the shot now have a new medical problem, a chronic medical problem or disability they're dealing with. 15%. The CDC vSafe data, that's the cell phone app that people downloaded to report their symptoms, disclosed that 7.7% of people who take a shot get so sick they go to the ER or get hospitalized. That's how dangerous these are, 7.7%. So Dowd's data is correct. We have record numbers of people now who are sick and disabled. The actuarial numbers on death are skyrocketing. We have fatal cases pouring in, 3,400 peer-reviewed papers in the literature on fatal and non-fatal injury syndromes. We're talking fatal myocarditis, progression of atherosclerotic heart disease, fatal stroke, intracranial hemorrhage, fatal blood clots, deep venous thrombosis, pulmonary embolism, fatal Guillain-Barré syndrome, multi-system inflammatory disorder. This is not controversial. This is published in the peer-reviewed literature. And so that's the reason why our autopsy paper is so important. It just summarizes the autopsies. Many of these other clinical studies didn't perform autopsies, but if they were performed, we would learn that about 74% of unexpected death is due to the vaccine if someone indeed took the shot.
And so what happens? Will this become a massive class action lawsuit against pharma, or will that never come to that? Or they're not liable, so it won't matter anyways. Will there ever be an admission or a conclusion by a mainstream government or a agency claiming that this has happened, or will this just be brushed under the rug for a long time?
It's hard to predict. I mean, how could one predict the biggest biological safety catastrophe of any medicinal product in the world's history? I mean, think about how many people took these shots. What if there's a class action lawsuit? There's not enough money to go around. I mean, one could envision something like a giant tobacco settlement and say, listen, hundreds of billions of dollars went to the pharmaceutical companies with no bid contracts. They had no development costs. They had no sales force. That money needs to go all the way back now to the people who are disabled. And in my practice, I have young people amputated, people with ICDs in place, people with movement disorders. They can't walk. They're in wheelchairs with transverse myelitis. It's like a war. I mean, if I was to summarize, it'd be like a war. If you take Americans and the CDC acknowledged deaths, and right now up to July 23rd, was roughly 17,655 deaths. And multiply that times an accepted underreporting factor, because the deaths are grossly underreported. Dr. David Weisman has in the FDA record, unchallenged, an underreporting ratio that's conservative at 30. In the peer-reviewed published literature, it says it's 40. But let's just take 30. 30 times 17,665. We're talking about over 500,000 Americans dying of the vaccine. Dying of the vaccine. That's worse than the Civil War. That's worse than any war we have. But let's just take what the CDC admits to, 17,665. And then look at that number. Do you know 1,100 people died, Americans died of the vaccine on the same day they took the shot? Some people just die in the vaccine center or a few minutes or a few hours afterwards. It's that acute. 5, 10, 15, 50 deaths should have been off the market. How could anybody walk into a vaccine center knowing 1,100 Americans ahead of them have dropped dead right in the vaccine center?
You recently did some media where you also pointed out that we could be looking at vaccine injured in some of the highest levels of our government, including President Biden, Senate Majority Leader Mitch McConnell, Senator Feinstein, and you were watching some of their behaviors and you saw potential vaccine injuries. Can you speak more about that?
I was asked by Fox News to come on with Laura Ingraham last week and give...
To continue watching the rest of the episode for free, visit our website londonreal.tv or click the link in the description below.
So Jim Rickards has just recorded a video that's not available to anyone in the public, and he's going to be talking about how this upcoming recession is going to be fast, it's going to be bloody, it's going to be nasty. But at the same time, he's going to show you how you can position yourself to profit from all of this chaos. Now, we've made this video only available to our viewers. Go to londonreal.tv/Jim. Watch that immediately. I can't say enough good things about Jim Rickards. He understands the global economic system better than any guest I've ever had on London Real. His predictions are almost uncannily true, and you can learn how to profit from his vision, from his expertise, and his understanding of economics. So go to londonreal.tv/Jim or click the link below. It's an excellent, excellent look on what's going to happen in the future and how you can position yourself to profit from that. Jim is one of the best in the business, one of my favorite guests on London Real, and he's very, very good at predicting the future and showing us all to profit from it. So click the link, and I hope you enjoy.
The greedy bankers are about to do it again. In 2008, they crashed our financial system and nearly bankrupted the entire global economy. Then they received trillions of dollars in government bailouts. And after, they demanded fat bonuses paid for by you, the taxpayer.
It turns out the banks haven't just been screwing the American taxpayers, they're also screwing over their investors. Turns out the banking industry is the worst place you could put your money, despite enormous taxpayer bailouts.
Now the bankers are back to take away your financial freedom. They lie and tell you that cryptocurrency isn't safe. They try to make it illegal for you to choose how to invest your hard-earned money. They lie and say cryptocurrency is used by money launderers and criminals. But look at the record. It's the banks themselves that launder hundreds of billions of dollars every year to the biggest criminal operations in the world.
Leaked documents have revealed how some UK banks have helped criminals, money launderers and Russians under sanctions.
American authorities discovered that the Sinaloa cartel moved $881 million through HSBC accounts as bank officials turned a blind eye to the illegality.
The bankers lie and say cryptocurrency is not a real investment. Meanwhile, the smartest CEOs in the world are buying billions and billions of it. The truth is that banks lie about cryptocurrency because it makes them scared. The banks take $9 trillion per year of your hard-earned money, and they are worried that they will finally be exposed. They're scared because crypto means they can no longer control your money, which means they can no longer control you. They are scared because you might actually understand your money and intelligently decide what to do with it. Now is the time for us to come together, fight back, and take control. It's time to educate ourselves, our families, and our communities. Because financial education means financial freedom. We know that cryptocurrencies will help us build the new decentralized financial system of the future. A banking system that is of the people, by the people, and for the people. A banking system where access to finance is a fundamental human right. A banking system that is free and fair and welcomes all humans on this earth. The DeFi revolution is happening. We, the people, can no longer be fooled. We choose to take control of our finances. We choose to take control of our freedom. We choose to take control of our future. Join us, and let's take back our financial freedom forever.